You know, every time you go to the doctor, a story gets written about you, but it's not written in sentences or paragraphs. It's written in a kind of secret language made up of codes. And no, it's not just about billing. It's a massive universal system that translates your health journey into incredibly powerful data. And in this explainer, we're going to learn how to read it.
So yeah, that's the million-dollar question, right? We're going to peel back the layers on medical coding to see how one single diagnosis, your diagnosis, can become part of a global conversation about health, and how that conversation can actually end up saving lives.
So here's our game plan. We'll start with the language of disease itself, then we'll crack the coding rules. After that, we'll dive into 3 really critical conditions, sepsis, HIV, and COVID-19, to see how those rules work in the real world. And finally, we'll zoom out and see why this secret language matters to every single one of us.
Okay, let's dive right in. First up, the language itself. Its official name is the ICD-10-CM. That's a mouthful, I know. It stands for the International Classification of Diseases. Basically, you can think of it as the ultimate global dictionary for, well, pretty much every medical condition you can imagine. And get a load of this. This is literally a page from the manual itself. Today, we're zoning in on infectious diseases. But don't think of this as just some dusty old book. This is the official playbook, the rule book that doctors, researchers, and public health officials use all over the planet.
You know, to speak any language, you first got to learn the grammar, right? The rules that hold it all together. Well, medical coding is exactly the same. So let's crack open that rulebook and see the fundamental grammar that makes sure every coder is telling the exact same story. So this whole system, the ICD-10-CM, it is the absolute bedrock of modern medicine. It's this huge, comprehensive library that slaps a unique code on every single diagnosis, symptom, and procedure. It's the shared language that lets everyone in healthcare, everywhere, talk to each other. In this right here, this is probably the #1 most important rule for coding infections. You've got to name the bad guy first. The story always begins with the specific organism, the bacteria, the virus, whatever it is that's actually causing the sickness. And this slide just lays it out so perfectly. It's all about cause and effect. The cause always comes before the effect. You code the underlying disease first, then you code the symptoms or complications that it's creating. Get that sequence right, and suddenly a jumble of codes turns into a crystal clear story of what's happening to a patient. All right, enough theory. Let's see how these rules play out in the real world. Our first case study is sepsis. This is a terrifying, life-threatening emergency where the body's own immune system goes haywire. And in these situations, getting the code right isn't just paperwork. It can literally be a matter of life and death. Now, sepsis is scary because it progresses in these really clear, really dangerous stages. It can start as just bacteremia, which means bacteria in the blood. But if the body overreacts, it becomes sepsis, which can cause organs to fail. The final, most deadly stage is septic shock, a total circulatory collapse. And you better believe each of these stages gets its own increasingly urgent set of codes. So how does a coder capture that terrifying story? Well, you build it, layer by layer. Step 1, you name the bad guy, the infection that started it all. Step 2, you add the special code that shouts, "This has escalated to severe sepsis." And step 3, you tack on codes for all the collateral damage, like kidney failure or respiratory failure. Okay, let's put it all together with a real-world example. Imagine a patient has sepsis caused by that nasty superbug MRSA, and it's led to their lungs shutting down. A coder would line up the codes to tell that exact story. The cause is MRSA, the effect is severe sepsis, and the manifestation is failing lungs. It's the entire diagnostic picture told in just a few codes. Okay, so we've seen an emergency. Now let's switch gears to a chronic condition, HIV. And this is a whole different ballgame. Coding for HIV requires an incredible amount of precision and nuance for a very, very good reason. The absolute #1 rule here is about confirmation. The special code for HIV disease, B20, is only used when a doctor has definitively said, yes, this patient has an illness because of HIV. If a diagnosis is just suspected or possible or likely, you absolutely under no circumstances use that B20 code. And that's a critical safeguard to protect a patient from having a wrong diagnosis follow them around forever. Now, on the flip side, when a patient is confirmed to have an HIV-related illness, maybe an opportunistic infection, that B20 code moves right to the front of the line.
It becomes the principal diagnosis, the main character of the story, framing everything else that's going on with that patient.
And check this out. This example from a training manual just nails it. A patient has a positive HIV test, but they feel fine. They're asymptomatic. The right code isn't B20, which means HIV disease. Nope. It's R75, which basically just says the lab results are inconclusive. See the difference? It's not a clinical diagnosis yet. That level of precision is absolutely vital.
Okay, for our last deep dive, we're looking at something we all lived through. And it shows how the system, which can seem so rigid and set in stone, is actually a living, breathing thing. Because when a new threat like COVID-19 appeared out of nowhere, the entire world needed a new chapter in the code book. And they had to write it like yesterday. And this was the result. U07.1. This one little code was created and rolled out globally at a speed that was just unheard of. It gave every doctor, every hospital, every country on Earth a single unified way to count and track confirmed cases of COVID-19. Seriously, this little code was one of our most powerful tools in the fight against the pandemic. But of course, the story didn't stop there, did it? As we started to understand long COVID, this system had to adapt all over again. So a brand new code was created, U09.9, specifically for post-COVID conditions. This gives researchers a way to actually track the long-term fallout from the virus, separating it from the initial infection. And look at that, we're right back where we started. That fundamental rule of cause and effect. If a patient gets pneumonia because they have COVID, you code it in that exact order. First comes the cause, U07.1 for COVID-19, then comes the manifestation, the code for pneumonia. The grammar always works, even for brand new diseases. So, we've walked through sepsis, HIV, and COVID-19. Let's pull back now for the big picture. Why should we care about this super detailed, kind of secret language? What's the big deal?
Well, it matters because this coding system is basically the central nervous system of modern healthcare. On a small scale, it makes sure you get the right treatment and the right bill. On a bigger scale, it lets hospitals plan their resources. It's the absolute backbone of public health, letting us track disease outbreaks in real time. It powers medical research. From one person's chart to a global pandemic response, these codes are the threads that tie it all together.
So every single code tells a story, and every single day, millions of these stories are being written, creating this massive coded library of human health. The real question is, what incredible secrets are hiding in that data, just waiting to be discovered? What's the next story it's going to tell us? That is the hidden power of the secret language of disease.